pleasant good morning and a very warm welcome to the Ministry of Health's update on the national COVID 19 response for Monday, 27th September 2021. I do hope that your Republic weekend was a safe one and your week ahead is productive and fulfilling. Our panelists for this morning's COVID 19 update are Dr. Rushan Parashram, Chief Medical Officer, Dr. Avery Hines, Technical Director, Epidemiology Division, Ministry of Health, and Mr. Brent Teixeira, a COVID 19 survivor who will be sharing his story with us. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and your moderator for this morning's update. Dr. Parashram will begin with the latest clinical and vaccination updates, followed by a presentation where he shares some statistics on COVID 19 patients.
Hi, good morning. Thank you, Al. And good morning to Dr. Hines, Mr. Teixeira. Welcome to the Ministry of Health's press conference. Good morning to members of the media and members of the viewing and listening public. So as is normal, we'll begin with the COVID-19 update for September 26, which is yesterday, at 4 p.m. Total number of persons tested so far in the public and private facilities now stand at 344,713. Our new positives over the last 24 hours are 127. Taking our total positive since 12th of March 2020 to present to 49,949. Of those, in terms of recovery, we have 44,176, leaving us with an active caseload of 4,316. Those persons in home isolation now stand at 3,827. And in my follow-up presentation, I'll be going into some detail as to what are the characteristics we are seeing in that particular cohort. In terms of number of deaths, we have 1,457, and condolences to the relatives of all of those persons that would have passed away during this pandemic. Total patients in step down at 70, those persons in hospital at 292, and in state quarantine 156. In terms of our vaccination update, those persons receiving partial vaccination, one dose now stands at 566,711. Completed vaccinations, total persons with a second dose regime, 463,072. Those persons with a single dose, 15,715, giving us a total persons completed vaccination regime now standing at 478,787. If I could have my first slide of the next presentation. So this gives you an idea, as I said, of the active cases in the community at this point in time. This was as of this morning. So we're looking at Tobago on the top left at 11.5%. Going clockwise, St. George West 7.0%, St. George Central 10.4%, St. George East 8.5%, St. Andrew St. David 6.5%, Caroline down at 15.3%, River Mayaro 2.0%, and St. Patrick at 13.0%. Victoria still higher than most at 25.7%, the highest in the country at this point in time. Next slide. So we go into the clinical case disposition. Recoveries are at 5.0% of the total group, transferred to facility 4.3%, symptomatic at 43.3%, and asymptomatic at 47.4%, which is very similar as it has been for quite a while. Comorbidity breakdown. Next slide. So we really have diabetes on the right-hand side, which accounts for 25.9% of those persons. Those with hypertension, 38.6%. Heart disease, 2.9%. Pulmonary issues, 0.3%. Immunodeficiencies, 0.2%. Asthma, 16.0%. Others, 13.0%. Pregnancy, again, is in there at 3.2%. It's not a comorbidity, but it does increase your risk of having complications. Next slide. Percentage comorbidities for home isolated patients. With comorbidities, 37.1% of the entire group. Without comorbidities, 62.9%. And the critical ones that we look at, the ones that I went through before, diabetes, hypertension, asthma, heart disease, and we also look at persons with obesity as being a comorbid state as it relates to COVID-19. Next slide. Patient distribution by age, starting on the left, and Dr. Hines will have a similar slide going into age distributions. 0 to 19, 6.94%, 20 to 39, 28.55%, 40 to 59, 29.09%, 60 to 79, 19.36, and 80 plus 16.06. My final slide. So the last slide just gives a male-female ratio of the active cases for the 7.0% on the right-hand side for males and 53.0% for females. More or less just has been hovering around 50-50 for the entire pandemic in Trinidad. So it remains more or less the same. So thank you, Mr. Alexander, for giving me the time to do the clinical update for this morning.
And thank you, CMO. Dr. Hines will now present the latest epidemiological update, which outlines how our behavior over the past weeks has affected the spread of COVID-19 in our population. Morning, Dr. Hines.
Good morning. Thank you, Mr. Alexander. Good morning to the CMO. Good morning to Mr. Teixeira. Good morning to members of the media, members of the viewing and listening public. If we can go straight into my first slide, we'll dive right into the epidemiologic update, starting with the epidemic curve. Next slide, please. The epidemic curve, as we've seen it, represents the day-by-day numbers of cases as they are diagnosed, numbers of cases reported by date of collection. The months are represented by different colors, and what we see that the highest month was that month in the gold, which was May, followed by June, where we had a decline from May to June, and when we got into July, we started seeing basically similar numbers of cases from day to day in July, in August, and to the same extent in September. So we describe that similarity in numbers of cases from day to day as a plateau. Same numbers over a protracted period of time. And that's also demonstrated by that rolling dotted line that runs through this graph. If we aggregate that on a weekly basis by epidemic weeks, next slide, we see a similar pattern. And that pattern is that the sections are in the same colors, the fuchsia for July, indigo for August, and that orange for September. Those bars at a weekly time scale are still approximately the same height. They may fluctuate from one week to the next, but they've been traveling along at that particular height for the last several weeks, actually basically the last 3 months. If we compare Epi Week 38, which is the last completed one, with the week just before that, we see that there's only a 1.2% difference between the totals. So we have been seeing fairly consistent figures over a prolonged period. And that salmon section of the background is what we refer to as the positivity. That's red on the axis on the right-hand side, and you see that that has hovered between 25 and 30% throughout that time period. So we're in something of a balance, a steady state as more movement occurs, and other things that we've been doing to reduce the vaccination, to reduce the spread, including vaccination in particular, take hold. We're seeing that there's a balance between movement and these restrictions and protections that's hopefully preventing too much of a steep upward trend at this point in time. Let's move to the next slide. Nope, that's backwards. Let's go forward. If we move to the next slide, so 2 slides forward now, we look at the same information now at a monthly time scale. And you see the same thing, same colors, similar heights of those bars for July and August. We're approaching the end of September. So hopefully by the time we get to the end of September, we'll have a slightly lower total for September than we had for August. But that background salmon section still says hovering between 25 and 30%. And the important thing to look at and to remember here is that what we're doing in terms of increasing movement for economic activity, but at the same time increasing vaccination levels and holding certain restrictions in place, the mask wearing, the hand washing, reducing size of gatherings, these things are in equilibrium. They form a balance that we are delicately trying to maintain and hoping, even with that balance, to get a decrease in the numbers of cases if we stick to the regulations and increase our vaccination levels. Let's move to the next slide. Now, the demographics are largely as the CMO has just demonstrated. Over that time period from the start of community spread in July 2020 to now, we see basically a 50-50 or so male-female balance in the total numbers of cases, majority in that 25 to 49-year-old age group. But when we go to the next slide, we see that the fatalities occurred largely in the older age groups, so about 2/3 of them or so in the above 60, but there have been significant numbers in the below 60, so it's not that once you're under 60, you're free and clear. And the other issue is that people with pre-existing illness, what we call comorbidities, whether it is diabetes, hypertension, renal disease, otherwise, these individuals have a higher risk of having an adverse outcome, and therefore we want to renew the call and renew the encouragement to all of these individuals to have their vaccinations, because the vaccines greatly reduce your risk of severe illness and reduce your risk of death. Next slide, please. Looking at the geographic distribution, we see, as we've seen in the past, there are certain communities with higher levels or higher numbers over the last 2 weeks and others with lower numbers. And as we move forward, looking at the potential spread of the new variant, we do have to, again, encourage all communities, whatever activities you're engaging in, please continue to do so within the confines of the law and of the restrictions that will allow us to reduce the potential spread of any variant, including the new one. Next slide, please. If we compare the county numbers from 1 week to the next, looking at the purple bars in that bar chart as the penultimate week and the gold ones as the last week, we see that several of the counties actually now have a gold bar that is taller than the purple bar, meaning that there were increases from the penultimate to the ultimate week for this last 2 epi-week period. And this is something to look at, this is something to look out for, because any upward trend is cause for concern. So if we move to the next slide, we look at that information by epi-week over a several week period, looking from week 25 all the way through to week 37. And in several counties, we're starting to see now 3 weeks or so of incremental increases. And this is, again, cause for attention. We don't want the numbers of cases week to week to be creeping up. We want to ensure that we don't get fatigued in the adherence to the guidelines, and we don't start doing what we shouldn't be doing in terms of gathering, in terms of mask wearing, in terms of all the things that have been protecting us. We want to stick to the recommended behaviors so that we don't have increases at the community or at the county level. So that basically ties up the epidemiological update. And the main points being, we're seeing in some places, in some cases, increases, a trend of increase over the last couple of weeks that we want to be aware of and wary of. We want to continue to look at the vaccination numbers and to continue to have vaccination coverage increase. And we want to encourage everyone to adhere to the public health guidelines, as those two things, vaccination and the guidelines, are our way of preventing transmission. With that, I turn it back over to Mr. Alexander.
Thank you very much, Dr. Hines. I now invite Mr. Brent Teixeira, a COVID-19 survivor, to share his experience at hospital after COVID-19 and his road to recovery, and just why he encourages persons to be vaccinated. Mrs. Teixeira, good morning.
Good morning. Thank you, Al. Good morning, Minister Dayal Singh, CMO Dr. Parasram, Dr. Hines, our viewing and listening public. I was diagnosed with COVID-19 in October of last year. I had to be hospitalized at the Kuva Hospital with severe breathing problems. I couldn't walk 5 steps without feeling like I ran around the savannah at full hilt. Not being able to breathe is something we take for granted, and I certainly did. My experience at Kuva Hospital is that it's a fantastic institution. The doctors there were very professional. They treated me really well. I have not one single complaint I could make about the care that I got at that hospital. My mother works at a hospital in Florida that treats COVID patients, and being in contact with her, the exact same medicines, procedures, and everything is exactly the same thing that they're doing at the hospital in Florida. So I felt very confident that I was in the right place with the right doctors and the right medications, and everything was going to be taken care of. I was discharged after 16 days, 13 of which I had to be on oxygen. I was then sent to the Arima Hospital for a post-COVID clinic, which took care of all my underlying conditions that I'm now faced with. Heart problems, liver, kidney, lungs, and pancreas all were affected by COVID. I now have to live with a lot of these medical problems that I didn't have before. I still get brain fog. I still have problems with my energy running out after lunch. But I'm alive. If it wasn't for the doctors and that parallel healthcare system, I wouldn't be here today to let you know my experience. One of my worst experiences is the guy in the bed next to me, who became my very good friend, passed away. Sadly, he was his mother's only child, and she was a single mother. So we now have a mother that's left with alone. There's no one to take care of her. And this is something that's playing out in our country. Every day we hear there are 10 people die, or 15, or 8, or even 1. It's 1 family, or 8 families, or 10 families, and this snowballs into hundreds of people that are affected by this dreadful disease. I want to beg my fellow Trinidadians, please go and take the vaccine. I did, my entire family did, from my 15-year-old special needs child to my 89-year-old father-in-law. We have all been vaccinated without any side effects whatsoever. But it gives us a fighting chance of this disease invading our home. It's like putting on a bulletproof vest. If I were getting into a gunfight, I would rather have a bulletproof vest on than none at all. Doesn't mean I won't get COVID again, but it probably won't kill me and I won't end up in Cuba Hospital anymore. I am now have to live with a problem that I may require a pacemaker for my heart. I require 2 insulin injections every single day. And I also have anxiety over breathing. And sometimes I catch myself having problems to breathe, but it's really a mental thing. COVID is going to affect my life forever. For the rest of my life, it's going to affect me. If there was somewhere I can avoid someone, one person, for this not to happen to them, I would have done a good deed. I want to ask everyone in Trinidad, please, the earliest you can, go and get vaccinated. And it doesn't matter which vaccine it is. Don't think one is better than the other. They're all the same. And they work. So I want to ask Trinidad and Tobago today, please give yourself a fighting chance against this. We could beat this disease, you know. We could beat this. But we need to do our part. I don't want somebody to believe I will get vaccinated so they don't get it, but they won't get vaccinated so I won't get it. We all need to do this thing. And the quicker we do this thing, is the quicker we'll get back to being almost normal in our country. Again, I want to thank the CMO, Dr. Hines, for the fabulous job you all are doing in trying to make Trinidad and Tobago a safe place to live. Okay, thank you. Back over to you, Al.
I want to thank you, Mr. Teixeira, for sharing such an intimate and really warming experience. It's certainly touching, and thank you again for sharing that with us. Ladies and gentlemen, up next we do have our question and answer segment. We remind our media representatives to state your name and the name of the media house that you represent before asking no more than 2 brief questions. Identify the panelists to whom you wish to address each question to. Time permitting, we will accommodate a second round of questions. We will take the first question from Power 102.
Hi, good morning. Gregory McBurney here from Power 102 Doom Champions and 102.3 Lit. My first question is regarding our case fatality ratio in Trinidad and Tobago. It is the second highest in the Caribbean and quite high compared to other countries like India, UK, US, for example. What might be accounting for such a high case fatality ratio? And the second question is regarding the policy about that the Prime Minister spoke to last week about persons having to be vaccinated before they're allowed into restaurants and gyms, etc. I know the Minister of Planning is to hold a meeting today with stakeholders, but that aside, how is that policy consistent? Because state sector, for example, has no such policy. For example, licensing office and all these other Ministry of Attorney General, etc. So how is that policy consistent? Thank you.
Okay, so just in terms of the safe zone policy, as was discussed in the Prime Minister's update on Saturday, Minister Young, out of the Office of the Prime Minister, would have given an update on the progress thus far. Basically, we are working out the operational details regarding it. And then, of course, later on in the week, I think, prior to going into that phase, which is October the 11th, further announcements will be made, possibly coming out of the Office of the Prime Minister. So we'll leave that topic for that time. Dr. Hines will go into detail as to your first question.
Okay, thank you for the question. Now, again, one of the things that, or one of the dangers that we run into when we try to compare things like case fatality rates is you're comparing different populations with different systems for actually collecting data. So whereas we, for example, will collect data on any death with COVID-19, not necessarily from, but anybody who has both COVID-19 and has died, and count them among our COVID fatalities, other countries may not necessarily be doing the same. And that's just looking at the number or the size of our numerator in that case fatality ratio. Looking at the denominator, another factor that can play into that is the fact that as we get more vaccination, as people get milder illness, they may not even necessarily be either symptomatic or ill enough to seek care and get tested. So sometimes that denominator in terms of numbers of new cases, that denominator can also be affected by the fact that there's milder illness in the population. So while we look at the case fatality rate as an index of how many people are dying out of the number of people with COVID-19, because other countries may not necessarily collect data in the same way, the death registrations may not actually capture the same kinds of information or the information in a similar pattern, the comparisons aren't necessarily useful. For example, if you look at Italy, which had a case fatality ratio very similar to ours, the difference there between them and other European countries is the fact that their outbreak actually affected an older population, and the older population would therefore be at higher risk of having adverse outcomes. Our outbreak is affecting a population with high levels of comorbid disease, high levels of diabetes, hypertension, etc. And this has been a factor that we've been looking at from long before in terms of all of the NCD, move into shape, etc., those drives. And those drives are because the NCD prevalence in and of itself is a risk factor for adverse outcomes in general. So there are lots of things that could affect the perceived differences between case fatality ratio in one country or another. The most important takeaway is that knowing that we have a high prevalence of NCDs, what we need to have also is a high prevalence of vaccination to reduce the risk of those adverse outcomes. So if we take anything away from the case fatality ratio, take away the fact that we do need to increase levels of vaccination in order to reduce the risk of death. But thank you for the question.
Thank you very much, Dr. Hines. We now move to 98.1 for your questions.
And a very good morning to you, Mr. Alexander, Dr. Hines, Dr. Prasram, and Mr. Teixeira. Stephen Cummings, 98.1 FM. My two questions quickly. I'll start with Dr. Hines. Dr. Hines, we are noticing an increase in the Delta variant numbers. Is it something that we are missing in late stage detection? And I say this against the background of a report in one of the daily newspapers. I'm quoting one patient as having contracted the Delta while in a step-down facility. And it brings into question for yet another time, is the system of early rapid testing holding, and whether we need to deepen the discussion on the Delta and other variants. Is it something that we are missing in this regard, allowing for, as I say, late stage detection? And Dr. Parasram, someone raised with me the issue of the homeless and or street dwellers, whether there have been any official reported cases of the virus among this grouping in Trinidad and Tobago, and if so, how has that been treated with on an ongoing basis? Thank you.
Okay, thank you for the question, Mr. Cummings. Now, I don't believe that there's an issue of late stage detection where the Delta variant is concerned. What we do need to bear in mind is that there are two sets of individuals who are being monitored. They are the individuals in the general population who are being monitored by a random testing of samples from cases that show up in the population. And there's a set of repatriated individuals who weren't vaccinated and therefore are tested before they are released from quarantine. And we've had a number of the cases identified in that group. And we've begun to see now where cases are popping up in the general population. And those cases, of course, are cause for concern because of the risk of rapid spread of that particular variant, knowing that it's highly transmissible. But there isn't late detection per se. All we do is that we're aware that there's a new player on the board, so to speak, and the advice remains the same and just becomes more important. The advice being maintenance of the mask wearing, maintenance of the reduced numbers in gatherings, maintenance of the call for vaccination because the vaccine does protect against the Delta variant. So there is no real late stage identification or late stage notification. It is just that we are notified now, we are aware that this is another factor that we need to be concerned about, and it makes it even more important for us to follow the guidelines that we've been advocating for the last 18 to 19 months. I'll turn it over to the CMO.
Yeah, so in terms of your second question, as it relates to street dweller, in terms of the way they capture the data, I don't think that sort of category is captured by the health team in a great way. I will try to get some additional details from the Ministry of Social Development and see if we can get some further information as to that question. And of course, Mr. Cummings, we'll get that to you as soon as we can.
Thank you very much, CMO and Dr. Hines. We go to Radio Tambourine for your two questions. Good morning.
Hi, good morning. Clayton Clark, Radio Tambourine. My two questions. All right, Dr. Paris, from you in your presentation, with the number of active cases, show that Victoria is leading the way. What do you think has been resulting in that county having the most number of cases, and what can be done, what is being done to lower that?
Sure.
And my second question, last week, Chief Secretary of the Tobago House of Assembly, Ansel Dennis, said that beaches may reopen if there's a 70% vaccination. though he did not say whether he did not say whether he was referring to Tobago or the nation on a whole. What are your comments on that, and have there been discussions on the opening up of beaches in the light, given if vaccinations go up to increase? Has there been a percentage? What talks have you all had on that?
Yeah, so thank you very much for your question. So in terms of the Victoria numbers, Victoria has been, in terms of a percentage, for the longest while, I think for quite a while, maybe upwards of a few months, been the county that has had the greatest number of cases in terms of a percentage. They do have a quite highly populated area as well, so there's a large number of people in that particular county. Of course, the contact tracing done by the CMOH has been ongoing and continuous. So the work is continuing by way of test, treat, and isolate as best as they can. But what we require is people to really come forward and have their vaccination as quickly as we can, not only in Victoria, in all the counties across the country. So that will give you that level of protection from COVID-19. I think that's the main thing that we need to focus on at this point, is really getting those vaccination numbers across the country up as quickly as we can, especially in light of the issue. And we're seeing that Delta variant is now reaching to the stage that can be stated that it is in community spread. We are seeing, we would have reported last night, 6 additional cases, 5 of which have no travel-related component to it. So we can clearly say that now we are in a stage of community spread of Delta, albeit in the early stages. With regards to the second question, as it relates to the Honorable Prime Minister would have mentioned beaches on Saturday as well in his presentation, and has already said that there was discussion around it, but those discussions are related to multiple factors, the epidemiological factors as well as the vaccine status of the population as 2 of the factors that are always considered, and we will continue to make recommendations. But ultimately, the Honorable Prime Minister will make a decision as to where and when those decisions will become implemented. Thank you.
Thank you very much, CMO. We now go to 103 FM. Hello, good morning.
Hi, good morning to everyone. Rai Rikomas from 103.1 FM. The question I have has to do with the 5 Delta cases that were reported yesterday with no recent history of travel. We want to find out, are these connected to each other? Are they connected to any other previous case of Delta? How ill are these persons? When would they have tested positive for the virus? And how many contacts would have been generated thus far? Thank you.
It was quite a large summary. I could give you a bit of it. So basically, in terms of the 5 cases, there have been 4 of them related to different positives from before. So there would have been contacts of other positive cases. Those cases themselves have not been deemed Delta as yet. Of course, testing is ongoing, noting that it takes about 2 to 3 weeks to get that Delta sample back to us. So out of the 5, there was 1 case that was basically a standalone sort of case where we are continuing the epidemiological investigation. But the other 2, so there was 2 that related to 1 case and another 2 in a different geographic location, again related to another case, right? Not known Delta. More or less what we're seeing is that the majority of them seem to be asymptomatic. And the reason we picked up those 4 cases is because of their relation to the other positives. We would have tested and used the new criteria and of course sent it onwards for Delta. So the majority of them so far, the ones that we have over those 5 people, seem to be having asymptomatic or mild disease. At least those are the ones that we picked up so far. So I hope that answers some of it. I don't know that I got all the detail that you wanted.
Thank you very much, CMO. We now move to AZP News. Good morning.
Hi, good morning, Priya Bihari, AZP News. I think Rai did ask my question there, but since we are seeing the Delta cases that tested, they're asymptomatic. Is that a concern for the ministry, and therefore should we be more cautious in terms of trying preventative measures for the COVID-19? And secondly, are you confident that all the vaccinations are working against the Delta variant? Thank you.
Okay, sure. So again, a lot of times, in terms of a disease being more transmissible, you tend to find that it causes a lot of asymptomatic spread and a lot of mild symptoms, so that it's very difficult to detect and moves very quickly through the population. So that is something that we see in Delta in particular. It is more transmissible. Therefore, it can move from one person to the next very quickly undetected. And again, we have to go back to what we have been saying since last year. It's an invisible pathogen, and we need everyone to take all the public health precautions. Just because you see someone that doesn't display any symptoms doesn't mean that they don't have COVID-19 and they can't transmit it. So we have to be very careful. And in terms of your second question related to vaccines, I presented a couple of weeks ago how Delta responded to different vaccinations. We have 4 vaccines in the country, and they all have very good safety and efficacy against COVID-19, including the Delta variant. So we are once again urging everyone, the best protection against Delta or any other variant at this time is the vaccine, together with your public health armory, masking, social distance, and the lot of them. Thank you very much, Brian.
Thank you very much, CMO. I did receive a text message a little while ago to Mr. Teixeira. The question is, how long after recovering from COVID did you actually take the vaccine? And how have you been feeling thus far after taking the vaccine compared to when you were living with COVID?
All right. I had to go by the advice of my doctors at the Arima clinic, and 3 months after I was tested negative, they told me it would be okay to take the vaccine. I had no side effects from it or anything, and I'm feeling normal. It's just another vaccine that we take, you know.
Okay, all right, thank you so much. We now go to TV6 for your 2 questions. Good morning.
Hi, good morning to the panel. Alicia Boucher from TV6 here. I just wanted to follow up on Rai's question a bit. In terms of the 6 cases, we noted that the ministry stated 2 were unvaccinated. Are we to assume that the other 4 were vaccinated? Were they partially vaccinated? What's the situation with that? And we know that Delta, one of the predispositions in terms of those at risk would be those who had prior infections before. So I wanted to find out, were any of the Delta cases that we've gotten so far repeat infections in that they had COVID-19 before and then they would have contracted Delta? And in addition, my second question is around reviewing the travel protocols and the current protocols for vaccinated nationals, based on the fact that they're allowed to come in with a PCR test no later than 72 hours, and then they're allowed to move around. Wouldn't that contribute to the situation that we do have with community spread of the Delta variant? Thank you.
Okay, so basically you asked about the unvaccinated. So there's 1 person out of all the adults that had a vaccination prior. All the rest were unvaccinated, including the minors. As it relates to, just remind me of your second part of that first question. Yeah. So while you're giving me back the second, we're not hearing you, but while you're giving me back the second one, in terms of your travel protocol, let us go back. So Delta, in terms of what we're seeing, seems to be community spread, and more so, seems to be community spread for quite a couple of weeks, if not a little bit longer already. Our travel protocols continues to be updated, and we will make the necessary amendments as we see fit going forward. And I had presented before that our risk for a vaccinated person in Trinidad converting is 1 in 7,000. It's an extremely small risk. We saw data coming out of other parts of the world with a similar sort of rate. 2 out of 10,000 we got from a state in the US as well, of vaccinated people having a negative PCR and then picking up positive thereafter. So the risk is there will always be risk as long as people move from one place to the next of transmission of COVID-19 and any other disease that you would have. So it is about managing the risk, having policies in place to mitigate against them as best as you can. And then, of course, it will be continuously reviewed as we go forward. If you could remind me of the second part of the first question. Still not hearing you. So I suppose we'll come back to her.
Yes, we will go back. We'll come back. So we move to.
Okay, sorry
Yes,
about
you're
that.
back. Yes.
All right, so the second part of the question was that in terms of whether we've seen any of these Delta cases that we've gotten so far being reinfections where persons had COVID-19 before and then contracted the Delta variant.
So as far as we could tell, none of the infections were secondarily picked up at that at Delta. Persons would have had COVID before. There's one, as far as I'm aware, in terms of the media, there's something circulating in the media where there's a premise that someone says that they would have been infected twice. So in terms of the way Delta testing works, generally speaking, that person indicated that they would have been tested a second time, and then the same week they would have actually gotten a Delta positive. More than likely, we're looking into the case together with the Southwest Regional Health Authority. Delta testing takes about 2 to 3 weeks. So generally speaking, it would have been that first test, not the second test, that the individual had, that would have been run and be positive for Delta. So the Southwest Regional Health Authority, through the CEO, is actively following up on that case, and they will give us some feedback later on today, hopefully.
Thank you very much, CMO. We quickly move to the Newsday for your 2 questions. Good morning.
Good morning, everyone. Marianne McKenzie from Newsday here. I was just hoping to get a bit more information on the Delta cases in terms of are they still hospitalized, and if so, how many, and how many have been discharged, how many in home quarantine, things like that. As for my second question, this is for Mr. Hines. Mr. Texera mentioned issues with the pancreas. Could you just expand a bit on those issues, or what issues could a COVID-19 patient have with relation to their pancreas? Thank you.
Okay, so generally speaking, I think the majority of the Delta cases so far are at home. I will confirm with the hospitals, both CEOs, just to make sure. But I believe we may have 1 or 2 persons still in isolation, more for decreasing the risk of spread rather than for medical reasons. But I will confirm that information. Mr. Teixeira.
Dr.
I think the question is to me based on the statement made by Mr. Teixeira.
So,
So, what happens with COVID-19 in particular is that it can cause side effects on multiple organ systems. So, as Mr. Teixeira pointed out, that he has since been made aware of different organ systems that aren't functioning as they were previously because they do a full checkup. They check to see whether everything is as it was: kidney function, pancreatic function, etc. Your pancreas does a couple of things. One of the more important for the public health perspective is it helps to keep your blood sugar in check. So in the disruption of that pancreatic function, you can have disruptions of the blood sugar, in the disruptions of lung function, liver function, etc. What you have is the organs function not being as it was. So if it's lung function, you'd have maybe shortness of breath. With liver function, the liver is relatively resilient, so you tend not to have too many disruptions, but you may find that the liver, what they call those liver function tests, are a bit deranged, showing that there's some damage to the actual liver tissue, even if it's not affecting the actual overall function of the liver. So too with the kidneys, you may still be passing urine, etc., but your kidney function may be affected by how well you filter out the waste, including creatinine. So they look at all these different measures and they see, are they still within normal range or are they out of normal range? And if they're out of normal range after your illness, then the question is really, did this happen as a result of the illness, or was it just something that was revealed because you happened to have checkups when you actually came into the hospital? And it raises an important point, which is that we don't frequently do checkups as a population, especially as a male population. So even outside of COVID-19, one of the things we want to advocate is that the population goes for regular routine checkups, even in the absence of disease, so that things that you don't know about, things that may be asymptomatic, not yet manifesting, you can pick them up a little earlier. That's called screening. So we do want to encourage the general population to move their health-seeking behavior towards more early detection by regular checkups and screening for some of the routine things. So thanks for the opportunity to bring that into the discussion.
And we actually do have another question for Mr. Teixeira coming up in terms of did you have any pre-existing conditions, NCDs, etc., before getting infected? And I also think there's a opportunity to defend yourself against one of the statements that Dr. Hines said. I'm sure you would have been one to get your regular checkups. Please, Mr. Teixeira.
Well, actually, I was one that never went and got checkup. I felt good every morning, so I went out to work. I had no pre-existing conditions that I know of. I do take high blood pressure medication, but my blood pressure is never high because I take the medication, and I never thought of it as being a contributor to my severe disease. I know it's not normal. Everybody that gets COVID doesn't get it severe, but it's not worth the risk. It's not worth the risk.
Thank you so much for that. We go back now to our question and answers. We go to the Express. Ms. Budram,
good morning,
Kim
Budram from the Express. Firstly, CMO, there's a group, the Responsible Parents group of Trinidad and Tobago, that has issued a pre-action protocol letter to the Ministry of Health, the government, and this is over mandatory vaccination for school-aged children. Of course, the group is against that. So I'm asking, without having to get into that, if you are aware of this pre-action protocol letter, or the ministry is aware if there's been a reaction to it, and well, within, respecting all legal matters, what type of reaction is likely to come out of that exchange. Also, for some time now, we've been allowing positive patients to self-isolate at home, and there's a monitoring system in place. But of course, now we have Delta, and from time to time, we will get reports involving people who have, violated the guidelines, the health guidelines. They would have left their quarantine and that sort of thing. So this is to ask, in order to keep up with Delta, has the ministry had to adjust, or is it looking to adjust its monitoring policy for home isolation patients? Has that been necessary at all? Thank you.
So if I could take the second question first. So with regards to Delta, what we do is we continue, as you know, we have increased in terms of our discharge criteria for persons that have been confirmed, going back to a 2 negative 24-hour part. So that's one of the changes that we have made in terms of the policy. We continue to work with the Trinidad and Tobago Police Service as best as we can in terms of breaches, and they have been greatly assisting us in those instances. So as it relates to your first question, I am not personally aware of it, but again, if it is a matter that a pre-action protocol has been submitted, then it will be considered to some extent sub judice, and we can't really say a lot in the public. The general matter of school children, I would leave that for the Ministry of Education.
Thank you very much, CMO. We move to Guardian Media Limited for your 2 questions. Good morning.
Hi, good morning, everyone. Rashad Khan, Guardian Media Limited. So, CMO, I just want to tack on to this Delta discussion that we're having right now. Firstly, in some of those counties where we've noted that cases have been increasing, has any of the Delta cases been found in those counties? And what is the probability that those tests that are going to be done on the sources of infection for these Delta cases, that they too will come back as positive for the variant? And my second question is, at the beginning or earlier on, when we were having the discussion about vaccination and our vaccination policy, and we decided that, well, it was 6 months and then 3 months after an infection that someone will be allowed to get a COVID-19 vaccine. Is there the chance of that policy changing in the context of we now have Delta variant, which is seemingly in the population spreading around, and we know that that has a propensity to reinfect people who would have had an infection from a previous strain, and on the basis that we have doses that are on the verge of being expiring? So is there the possibility that maybe we could overlook that 3-month period, or is there a medical reason as well for not administering it for that 3-month period?
Okay, so in terms of your variants of concern, I think we would have said before there was 1 case in St. George West, there was 1 case in St. George East. We now have cases in County Caroni. We're picking up cases in St. Patrick, I believe, as well as and Victoria. So generally speaking, the cases will mirror where you have your positive cases in the country. in terms of it's a small space, so you tend to find where you get the positives. We'll be taking samples for using the criteria from across the country. In terms of a correlation with an increased rate, we haven't seen that as yet, which is a good sign, I think. Generally speaking, if you could remind me of the second half of your last question, Richard? Your second question. Yeah, so...
Okay,
yeah, so go ahead, we're hearing you now.
Yeah, or the second question, the second part of that first question was, what's the likelihood of these these sequencing that's going to be done on the sources of infection for Delta, coming back positive for Delta?
Yeah, I was asking about the second question. Sorry about that, but and I'll
the
answer
second
both of them.
question. Okay, the second question, short version is, early on it was mentioned that we were giving people that 3-month period after infection because of scarcity of vaccines. And now that we have vaccines basically going to expire, and the Delta variant, which can reinfect people who were infected with previous strains, could we see a change in that?
Okay, so generally speaking, the sequencing, if you have people in a household, for example, with Delta, who have been confirmed with Delta, generally speaking, if you have other positives in that household, which is the case in these instances, you would likely see those as being positive for Delta as well. In terms of the policy, as I said, we continuously review the policies, but if you take Mr. Teixeira's case, for example, he has COVID related to long COVID, where he has persistence of symptoms. So there's sound medical reasons why we have gone ahead and gone initially from 6 months back to 3 months, based on what we saw in the literature as well and what was being done in other parts of the world, together with CDC and PAHO's advice. We will continue to keep a very close eye on the changing policies, but we have to be very comfortable that the person has had COVID and is now free of disease before you go and introduce a vaccine into that situation. So we just want to be cautious, and we continue with the 3-month for now, and of course it will be continuously reviewed. And if new evidence comes forward, we will adjust as we need to.
Thank you very much, CMO. CL Communications, we are ready for your 2 questions.
Hi, good morning. Natalie Singh, Caribbean Lifestyle Communications. I have just a minor question. Explain how the step-down facility works. 1, for a national who didn't travel at all, and 2, for somebody who traveled and came into the country. I just wanted some clarification on that. And then secondly, I had put this question some time ago, and so I'm bringing it back because I haven't yet gotten the answer. What is the uptake of vaccines by teachers? Thank you.
Okay, so the second part of the question is really for the Ministry of Education, and maybe you can pose that question to the Ministry of Education for them to give you that detail. In terms of the step-down facilities, so generally when we conceptualize the step-down facilities, it was thought of offering a lower level of clinical care. So basically patients who require maybe some oxygen generally can walk about and take care of yourself to some extent. So we have also used it as isolation facilities for cases of variants of concern throughout the epidemic, starting with the Gamma variant, Alpha variant as well, and now Delta. So generally speaking, we have downscaled in terms of the number of step-downs we use for that purpose. The step-down that we use would cater for people who are already positive. So we won't put a positive and a negative in a step-down facility, in the same step-down facility. Generally, persons who are all positive in step-down, meaning they're either recovering from or have a milder form of COVID-19 when you go into that particular facility. We recognize all the infection prevention control guidelines have to be followed still, and we're asking people while you're in those facilities as well, although all of you are positive in that facility, that you try to continue to follow your guidelines, wearing your mask, and not to interact with those other individuals. They are patients as well. So we ask that you keep your distance as better as you can, and follow all the infection prevention guidelines laid out by the healthcare providers. So generally the step-down facility, I hope it answers your question, is used for positive patients, either before discharge, in terms of stepping down in levels of clinical care, or sometimes just after you come off from a community setting with mild disease, and it can be used for those we suspect with variants of concern as well, or somebody we need to isolate for another reason, for example, coming off a vessel and being positive.
Thank you very much, CMO. Ladies and gentlemen, that's all the time we have for question and answer segment. And in closing, we ask that you please continue to protect yourself and your loved ones. Remember, the COVID-19 vaccines are safe, they're effective, free, available, and accessible. No appointments necessary. If you haven't received your COVID-19 vaccination as yet, please get yours now. Don't delay, vaccinate today. We invite you to join us on Wednesday for another update, same time, same place. Be safe and goodbye for now.
Imagine not being able to breathe. Doc, I can't breathe. I can't take a full breath. And this is very important. Imagine not being able to breathe for a prolonged period of time, despite